Good day, students. Dr. Raskob here. It's good to be back with you after some time away. I know that Dr. Dale Brassler has taken very good care of you. Over the past few weeks, you have been talking about the healthcare system and health insurance. And now we're going to switch our focus and talk about the public health system and its importance in public health and administering public health services in our country. So our learning objectives are to talk about the goals of governmental public health. We will identify the 10 essential services of public health. We will talk about foundational public health services and look at how local, state, and federal public health agencies operate and the services they provide. We'll identify global public health organizations. We'll talk about roles in public health that are played by agencies which are not considered to be health agencies, but nevertheless influence our population health. And we'll end off talking a little bit about the need with collaboration by governmental agencies with other agencies, both governmental and non-governmental. Now, this slide describes a framework for how governmental public health agencies relate both to each other and to other parts of our overall public health system. Here you see that governmental public health agencies can operate at the local, state, and federal level, and even globally. And they relate to community and private organizations, but they also relate to other government agencies and to the healthcare delivery system in a very important way. The core public health functions, there are three. They are assessment, policy development, and assurance. And their roles, functions are defined here in this slide. And this is a standard approach to public health that requires obtaining data and defining the health of a population, and then specific subgroups, looking at issues, developing policy, evidence-based recommendations, and other analyses to address issues of health within these populations, and then the oversight responsibility for ensuring key components of an effective health system. So assessment, policy development, and assurance. And there are then 10 essential public health services that roll under these core functions. Two of the services are under the function of assessment, that is monitoring health status and diagnosing and investigating health problems and health hazards, much as we have just been doing with respect to identifying COVID-19, monitoring, identifying cases, diagnosing them, and contact tracing. Under policy development, there are three key services: informing, educating, and empowering the general public about health issues, developing and mobilizing community partnerships, and then developing policy and plans that address individual community health efforts. And under the function of assurance, there are four key services listed here. These are related to enforcing laws and regulations that protect the health of the population and ensure public safety, linking people to services and the provision of healthcare when it's otherwise unavailable, making sure that we have a competent public health workforce, as well as a healthcare workforce, and then evaluating the effectiveness, accessibility, and quality of different health services. And finally, all three of the core functions undertake research and gathering of evidence to further their mission. So the essential public health services, the 10 essential services, are listed inside this circle in these colored wedges, and the overarching three core functions of assessment, policy development, and assurance form an iterative circle where we assess, which is monitoring health, diagnosing, and investigating. We then develop policies, we implement those, and then we assure that they are undertaken and are doing what they're supposed to do, and then we evaluate their impact and feed that back into another assessment. So we have this iterative circle in which we assess, we develop policies, we implement, we assure they're operating and evaluate them, and the circle begins all over again. Now let's turn to discussing local health departments. These would be, for example, the Oklahoma City County Health Department or the Tulsa City County Health Department. And there are two models for how these local departments function. One is called the home rule model, or also called the local autonomy model. Here, the department is essentially independent. They have authority delegated from the state in statutes to operate and be independent. They usually have a separate board oversight, and they function independently of a larger state health department for the city, county, or constituency which they serve, and they have a great deal of autonomy. The branch office model is different. This is simply a local branch office of the overarching state health department. They have little authority or independence, and they take direction from headquarters, and they are budgeted and funded from the main budget of the state health department. Now, Oklahoma has a mix of these two models. Oklahoma City County and Tulsa City County health departments operate under the home rule model, whereas the rest of the counties in the state operate under the branch office. So if you hear Logan County Health Department or Cleveland County Health Department, that is a branch of the Oklahoma State Department of Health. Well, what do local health departments do? Well, this varies across the country in approximately 3,500 to 4,000 different local health departments, but they do, most of them do most of these services: immunizations, communicable disease surveillance and investigation of outbreaks, as we've just been through extensively with COVID and continue to be on that, communicable disease control, inspection and licensing of restaurants and food service establishments, environmental health surveillance, public health screening, tobacco programs, and so on. Public health preparedness in response to disasters. Now, they may also be a safety net healthcare provider for the uninsured or underinsured. And again, not all local health departments provide all the services, but most of them provide the majority of these type of services listed in this slide. The State Health Department collects vital statistics for the state. It runs and oversees the public health laboratory. It's responsible for licensing public health professionals, administering the nutrition programs, regulating health facilities, regulating drinking water. Often the State Health Department administers the Medicaid program. This is not the case in Oklahoma. There's an independent, separate agency entirely devoted to administering Medicaid. And sometimes the State Health Department may also have authority over the Office of the Medical Examiner. Now, health departments, like schools of public health, like universities, like hospitals, undergo the process of accreditation. Remember that accreditation is the way that we review and certify health and educational institutions, and credentialing is the process by which we certify and make sure that we're assessing, certifying, licensing individual professionals. So there is a public health accreditation board that is national, and this board oversees the process of accreditation, which for these local health departments and state health departments is a voluntary action at present. And however, obviously, these health departments know that having this good seal of approval and passing the bar for accreditation is a very important standard to indicate that you are a high-quality health department. And fortunately now, health departments serving over 75% of the U.S. population have or will be accredited in the near future. Now let's turn to the federal public health agencies. The Department of Health and Human Services, HHS or DHHS, is the central health and public health agency of the federal government. This includes operating agencies that report directly to the Secretary, and these are the Centers for Disease Control and Prevention. And in Table 12.2, the roles of these agencies are discussed in detail. The CDC is the lead public health agency responsible for fundamental and core public health matters in the United States. The National Institutes of Health, it's institutes plural. It's made up of several different institutes, for example, National Cancer Institute, National Heart, Lung, and Blood Institute, and so forth. It is primarily a research agency, and it is the nation's premier and lead research agency. The Food and Drug Administration is responsible for approving medications and for sale by pharmaceutical companies and regulating medications as well as cosmetics and food to a certain extent. The Health Resources Services Administration, or HRSA, carries out the delivery of a number of important health services. Particularly, it conducts the Ryan White HIV program, which provides assistance to low-income individuals with HIV. The Agency for Healthcare Research and Quality, the Agency for Healthcare Research and Quality primarily is responsible for researching and improving the way that we finance and deliver healthcare and assessing the quality of healthcare. Substance Abuse and Mental Health Services Administration is related to many different functions and services related to mental health and substance abuse. And the Indian Health Services provides health service to numerous tribes and tribal regions across the United States. Now, global health organizations and agencies, they increasingly are having an important role because public health is increasingly a global issue, and that's illustrated very starkly by what we're going through with COVID-19 now, where an infection begins in another part of the world, this time in China, and is now progressed almost entirely throughout the world and having very significant effects in parts of the world far away from where it originated. For example, in New York and Italy and Spain and so on. And so in Table 12-3, I'd like you to review and understand the governance and the roles and limitations of each of these agencies. Similarly, I want you to know the basics about each of the U.S. federal health agencies, and that's described in the table previously discussed, Table 12.2 and Table 12.3, discussing these agencies. So here it is for the global public health organizations. The World Health Organization, which is an organization within the United Nations structure. It has regional semi-independent components. For example, the Pan American Health Organization, which covers North and South America. And they are responsible mainly for policy development and recommendations to countries. They have very little authority over any countries, certainly no authority. They can declare a health emergency of global concern, which was declared with COVID-19, but they have limited ability to enforce these recommendations because they can't infringe on the sovereignty of individual countries. There are other United Nations organizations that do good work related to public health, UNICEF and UNAIDS. UNICEF focusing on childhood vaccinations and on some other things. And then there are international financing organizations such as the World Bank or other organizations. And the World Bank is very much involved in helping support the Global Burden of Disease Project, which assesses many different causes of death across 180 or more middle, low, and high income countries throughout the world. how can public health agencies work together? Well, there does need to be coordinated responses at the local, state, and federal level and globally into a unified effort to combat a particular event such as a pandemic, as we're seeing now with COVID. And we'll be able to analyze, of course, and learn many lessons about what worked effectively and what didn't in this collaboration. But it's absolutely critical that all of these agencies work together. Now, there are some governmental agencies that are involved in health issues, but are not in their title and appearance appear to be a health agency. So the Environmental Protection Agency evaluates environmental health issues, makes recommendations, and enforces regulations. Here, the current administration has been peeling them back very significantly in recent years. The Occupational Safety and Health Administration, or OSHA, is very important and has a role in primarily in prevention and working to reduce injuries and hazardous exposures in the workplace setting. The Department of Homeland Security takes the lead on preparation and response to disasters and terrorism. Department of Agriculture, very much involved in protecting the nation's food supply and working with CDC and FDA. Department of Housing and Urban Development, as we've talked earlier in the course, a very strong connection between housing and health, and they influence the built environment, and this has important impacts on health. And the Department of Energy sets safety standards, for example, for radiation or chemical or certain other aspects related to energy to make sure that we protect the public from the hazardous consequences of these possible plants and chemicals and work that they do. Now, there are non-governmental agencies that play a very important role, advocacy groups that advocate for public health interventions and for certain policies. There are private organizations like the American Cancer Society, the American Heart Association, the March of Dimes, the American Diabetes Association, and so on. These groups are very, very important to advocating for the interest of individuals affected by these conditions. They have grant programs, they fundraise and support grants and other things. They provide some basic public health education, but importantly, they support research and they can use their authorities to develop evidence-based recommendations from their membership, and they perform some other services as well. And then just a couple additional ones, CARE and Oxfam International, you may have heard of them, and then the Gates Foundation and the Robert Wood Johnson Foundation both fund public health efforts. They stimulate the government to spend on these areas by pledging matching funding. And they play a very important role in getting things started and funding new initiatives in health. Now, everybody working in public health, whether it's at the front lines clinically or on population health directly, really share several commitments to work together in various ways to foster evidence-based thinking, to deliver services in a cost-effective way, make sure that we're always delivering quality services, and to develop and maintain computerized and confidential data systems which can then be searched and analyzed much more rapidly than hands-on systems. Finally, we can engage with the community in two key ways. One is in research. Historically, research has often been done of just getting people to enroll in a clinical trial or asking for volunteers, and then we do research on them rather than with them. And the community-based participatory research involves community members at all stages of the planning and development of a research program. Let's say we want to research a community-based intervention to reduce overweight in children, then we would engage people of the community at the very beginning, discussing what we're trying to do, discussing strategies, and so forth. And there is a similar community-oriented public health speaks to the mobilization of both public and private efforts to solve a problem. So here in Oklahoma City County, we don't hesitate to reach out to our partners and colleagues in the private sector if we have a project that fits very well with them. So that takes care really of chapter 12. And we will, slides will be up on Canvas as well. And if you have any questions, don't hesitate to email through Canvas. And I hope that you're staying safe, doing well, and we will continue to work together to successfully conclude this semester. I want to thank you, all of you, for your patience, your thoughtfulness, and your dedication and commitment as we transition to a little bit of a different learning approach this semester. But please don't hesitate to contact us through Canvas. We're here and we will communicate and work with you again to help you continue learning and complete your program, your course here on Introduction to Public Health. Have a great day.